Clark?
Sure, yes. So good afternoon. My name is Chris Clark. I'm the program director for the Master's of Athletic Training Program. This is Greta Romei, and she is going to present on concussion and the treadmill test. So she's going to talk a little bit about that. So I'm going to turn it over to Greta and let her go for it.
Thank you, Dr. Clark. As I said, my name is Greta Romei. I am one of the Master in Athletic Training students. Thankfully, I had a chance to be with UAB and doing my clinical immersion with them. So I was lucky enough, or unfortunate enough, to deal with 13 concussions this past fall season in football. So I had a chance to put my hands on a lot of concussion rehabilitation. So before I start and go ahead and introducing my topic, I want to ask you something. How many people in this room are familiar with concussion and know about concussion? Raise your hand, please, if you do. How many of you heard the saying, the rest is the best option for treating a concussion? Raise your hand if that's what you heard. Okay, so today my job is to do the opposite, to inform you that rest truly is not your best option to treat a concussion. So, first and foremost, what is a concussion? A concussion is a traumatic brain injury. We refer to it as a jiggling of the brain. The mechanism of injury is unknown, so we see it happening on TV, but it can also happen during collision for a car accident. And what happens is there's a lot of chemical reaction that happens to the brain that damage it. And then to introduce what is the Buffalo Concussion Treadmill Protocol is my alternative to rest, or our alternative to rest. So it's a subthreshold aerobic activity. It's a test performed in different stages. 20 stages that last a minute on a treadmill, where you progressively increase the height of the treadmill, and you reach a heart rate max where an athlete starts to have concussion symptoms. And that's the level that athletic trainers take, then calculate the 80% off it, and base their activity level for the athlete to perform in order for them not to have symptoms while they perform activity. So rest prior to the 1940s was the only option that we had. So we all told our athletes, go home, turn your lights off every 2 or 3 hours, wake up, don't be on your phone, don't be on your TV, everything off, and whenever you feel like you're okay and everything is gone, we're going to start again. Now instead, different studies have shown how moderate to light physical activity right after a concussion happens improves concussion symptoms and allow an athlete to return to competition and to sport faster and in a safer manner. Therefore, my pick question for my study included my participants, so individuals diagnosed with sport-related concussions, my intervention, of course, the Buffalo Concussion Treadmill test that we explained, my comparison, rest, and the outcomes, faster recovery and improved post-concussion symptoms. Search strategies, I use different databases which include PubMed, Sport Discuss, Google Scholar, and JSU library databases. Search terms include the BCTT or the BCTT versus rest, as well as the subthreshold activities, because due to the fact that the test and the protocol is so new, it's not only known as the Buffalo Concussion Treadmill test, but also has subthreshold protocol. So the inclusion criteria includes individuals with sports-related concussion symptoms, studies conducted less than 5 years ago, and articles that were published in the English language. The exclusion criteria included studies that utilize other threshold protocols than the Buffalo Concussion Treadmill test, and studies that were conducted over 5 years ago. The evidence quality assessment, I used 2 different systems. I used the Physiotherapy Evidence Database, or PEDRO scale, and the Mixed Methods Appraisal Tool, or MMAT. I came out with 4 different studies. The first one analyzed the validity of exertional tests in assessing symptom exacerbation. The second one compared the Buffalo Concussion Treadmill test to another progressive exertional test. The third one assessed the predictive capacity of the Buffalo Concussion Treadmill test. And the last one assessed the changes in exertion-related symptoms in patients with sports-related concussion. This is just a summary of the articles and the grading. If you notice the grading, they are all pretty high. Therefore, the validity and reliability of the test is accurate. The very first one, named Early Subthreshold Aerobic Exercise for Sports-Related Concussion, this compared to different programs. One, where they use subthreshold exercise, and another one that just used stretching as a placebo for our comparison group. And the implication and results of the study demonstrated how light to moderate activity speed up the recovery for our athletes that were affected with concussion. Second one, reliability of a graded exercise test for assessing recovery from concussion. What I was trying to accomplish with this was trying to determine if different people using the same test obtain the same results, and if the same test if it's ran on multiple individuals, gives the same results. And that's what the study showed. Multiple individuals were able to perform the same test and obtain the same results, and the same variables that were measured imply the fact that the test is reliable and it's good to use it. Then the predictive capacity of the Buffalo Concussion Treadmill Test after sports-related concussion in adolescents. This used heart rate arrest, which was a term which was obtained by using a stretching program, and heart rate threshold that was used for individuals that were utilizing an aerobic activity as their rehab protocol. And it showed how there's a correlation between the individuals that have a higher heart rate to return to play and diminish symptoms compared to the ones that are at risk. So an increased heart rate speeds up the recovery from a concussion. And then my last study, changes in exertion-related symptoms in adults and youth who have sustained a sport-related concussion. This study was done in order to determine if the Buffalo Concussion Treadmill protocol is capable of obtaining and underlining the symptoms that belong to a concussion. And it was a good study for me to utilize because a lot of the symptoms that I saw whenever I was performing the test at UAB were a lot of those that I've seen here. So it was also a good source for me to learn from. For my clinical bottom line is that subthreshold physical activity, because we can call it that way, is effective for the management of sports-related concussion. The Buffalo Concussion Treadmill Test is valid, safe, and it's reliable. And ultimately, the test itself and the protocol speeds up and improves the symptoms in patients that are affected by sports-related concussion. The implication, the Buffalo Concussion Treadmill Test compares well with other subthreshold protocols that we can use in our everyday practice. Is a better option than rest because it allows our athletes to come back to play their sports in a faster and safer manner. And just like I mentioned, it's safer for RTP or return to play. So future research that I'm particularly interested in is one, the National Athletic Training Association or NATA position statement needs to be updated. We now have a position statement that says rest is your option until you start return to play. But the research I've done up until now shows that this is not my best option. And then something I'm really interested in is the timeline on when to perform the subthreshold aerobic activity. My time was 48 hours post-concussion, but it's really just a date I put there just because the first up to 72 hours, that's when your inflammation period is. But we don't really know when it's safe enough to start, if it's too early or if it's already too late. And then ultimately, we live in a world in America that is based off football, and involved this year with the Dolphins, we saw many concussions happening to the same player, and we learned in our past that chronic traumatic encephalopathy can happen and it's real. And I would like to see more studies performed on athletes and being able to determine when an athlete is still alive if that's the route that they're going to end up having. A lot of behavioral issue that we see with our NFL players or just collegiate players are leading us to that road, and it would be good for us, future athletic trainer, to be able to say, you're having too many concussions, for if you want to live as a sane individual, we need to stop your career here. It might be sad, but it's for our athletes more than anything else. And then ultimately, these are my references. Then I have some acknowledgement. I would like to thank Jacksonville State University and the JSU Symposium for the opportunity to stand up here and share my knowledge. I would also like to thank Dr. Savage and Dr. Clark and all my classmates for the support that they have given me throughout these 2 past years. And also I would like to thank, they're not here, but my preceptor at UAB, because one thing they taught me is to never stop learning, and what we learn, it's going to be for our athlete and the best care for them. And if you have any question, go ahead and ask. Before you say anything, I have a very funny joke. So there's 2 individuals that go inside of the bar. One asks the other. One says to the other, if I had to learn one thing from a wise man, is to always love with your heart and do everything else with your head. And the other person says, so what happened to that person? And the other one replied, he died from a concussion. Yes, sir.
Okay, so you said the initial test, they ramp up higher and higher this treadmill until they get to the symptoms. What are the symptoms?
So pretty much the same as you would have after a concussion. So you could be lightheaded. You could have the sound would affect you. You could be dizzy. You could be nauseous. So there's a long list of different symptoms, and the way it works is if you have an increase, so it starts from 0. So the first thing that you do during the test is you start from 0, what you feel like right now. Let's say that you have dizziness, that it's 1. Then I start performing the test and I go up in level. If there is a difference of 3 or more points, so it keeps going up, from a 1 goes to a 3, that's where I'm cutting you off. And it has to be 1 to 2 symptoms that increase from cutting you off. But it's pretty much the same exact symptoms that you will have following a concussion, because we're trying to determine when it's safe for you to perform activity like the level that you want to perform at in order for you not to start having those symptoms. So pretty much having you in a condition where you will be at rest, so the same exact condition itself, but you're performing activity. And we learned, I think, during this past couple of days with my classmate up here too, that blood flow is the main important things for us to restore the metabolism of any system. So we want the blood flow to increase no matter what injury it is, for bad things to go out of your body and good things to stay in.
Great job.
Thank you, ma'am.
So you're going to recommend this to our JSU athletic trainers?
You what?
Are you going to recommend this to our JSU athletic trainers?
I would love to. I don't have many chances of being in contact with JSU athletic trainers, but it's something that I've never seen before. So the very first thing that my preceptor at UAB told me whenever we had a concussion patient and told me go run a Buffalo concussion test, I just looked at them and I was like, huh? So it's something that I learned and I want to keep learning about it, and I think it's something that it's safe enough for us to do instead of just saying let's wait until symptoms are gone before starting our return to play. So I would love to share it. I don't know how many concussion there has been lately, and I honestly don't know what's the protocol here that they use, but I would definitely suggest this. It's been very useful. In all the cases, all my athletes came back fast, beside one, but we learned later on that he had second impact syndrome. That opens another window of things, but yeah. Any other question?
All right, let's thank our speaker.